Hey, future health heroes! Get the study guides and tips you need to ace your nursing exams. Follow us for more.
Your brain, it's the most complex, energy-hungry, and vital organ you've got. It's the command center for literally everything. But all that complexity makes it incredibly vulnerable. So, how in the world does this amazing command center defend itself from a constant barrage of threats? That's what we're going to dig into today.
And it's a really important question, right? Every single minute, your blood is carrying all this great stuff, nutrients, oxygen, but it's also carrying potential threats. We're talking toxins, pathogens, random chemicals. If any of that stuff were to reach your delicate neural tissues, the results would be, well, catastrophic. The answer lies in one of the most elegant and sometimes one of the most frustrating structures in all of human biology.
So think of it like this. Your brain has hired the most exclusive, most discerning bodyguard in the entire world. This bodyguard isn't a person, of course, but a microscopic, living wall that's on guard 24/7, making life-or-death decisions every single second.
This gatekeeper is the first and last line of defense. Its job sounds simple enough. Let the good stuff in and keep the bad stuff out. But it's not just a simple filter. It's an active, intelligent, and incredibly sophisticated security system.
Okay, so how does this microscopic security system actually work? Well, its power is in a really unique biological structure with a very specific name and an absolutely vital job in keeping the brain's environment perfectly balanced.
It's called the blood-brain barrier, or the BBB for short. It's made of a special layer of cells that line the brain's blood vessels. Now, capillaries in the rest of your body are kind of leaky, which is fine, but in the brain? Nope. These cells are sealed shut with something called tight junctions. Honestly, just picture mortar between bricks. It creates this nearly impenetrable wall that stops most things from just drifting into the brain. And this barrier has an incredibly strict access list. Essentials like water and oxygen, they get a VIP pass, no problem. Certain small molecules that dissolve in fat, we call those lipid-soluble, they can also kind of slip through. But almost everything else, access denied. That's how it blocks out toxins and pathogens. And this is so important for medicine, it's also why it blocks most drugs, especially the big ones. That presents a huge challenge when we're trying to design pharmacological treatment.
And that right there brings us to the central paradox of the blood-brain barrier. This guardian, this brilliant protector, can actually become a healer's biggest enemy when the brain itself is the one under attack.
Think about these devastating conditions that start inside the brain, things like tumors, Alzheimer's, or Parkinson's. In a lot of these cases, we have powerful drugs that could potentially slow down or even stop the disease in its tracks, but there's a massive problem.
So get this, the very barrier that's designed to protect the brain is now preventing life-saving medications from ever reaching their target. The bodyguard doesn't recognize the medicine as a friend, so it just slams the door shut. This is one of the single biggest hurdles in neurology and pharmacology today.
But of course, scientists and doctors are incredibly persistent. If you can't just break down the door, maybe you can find the key. The goal isn't to destroy the barrier, that would leave the brain completely defenseless, but to find a way to temporarily and safely escort medicine across it. And here's the key insight. The barrier isn't just a static wall. It's a living system with its own specific gates and transport mechanisms designed to actively pull in all the nutrients the brain needs, things like glucose and amino acids. And now, researchers are figuring out how to exploit these secret passages.
This is where pharmacology gets really, really clever. You can essentially attach a drug to a molecule that the brain's transporters already recognize, a molecule they want to let inside. It's basically a Trojan horse strategy. By hijacking these natural pathways, we can completely change the pharmacokinetics and deliver treatments right to the brain tissue where they can do the most good.
Okay, so let's bring this all back to what it means for patient care, because understanding the science is fundamental for any healthcare professional, especially in nursing. Applying these principles of pathophysiology and pharmacology means you have to recognize that the blood-brain barrier isn't a one-size-fits-all system.
You see, a patient's age and their overall health can dramatically change how well the BBB works. For instance, the barrier in a newborn isn't fully developed yet. In an older adult or someone with a neurological condition, it might even become a bit leaky. Understanding these patient-specific characteristics is absolutely central to providing safe and effective care. Let's look at two very different patient populations to see what I mean. For newborns, that underdeveloped barrier makes them incredibly vulnerable to toxins that an adult brain would just block without a second thought. This is why nurses have to be so vigilant, constantly monitoring for neurotoxicity, and why every medication dosage has to be calculated so precisely. Now contrast that with a healthy adult, whose robust barrier gives us that drug delivery challenge we've been talking about, requiring specialized pharmaceuticals just to get past the gatekeeper.
And this is exactly why the nurse's role as a member of the interdisciplinary team is so critical. The nurse is on the front lines, using the nursing process to assess how a patient is responding to treatment, monitoring for any side effects, and helping to modify care plans on the fly. And effectively communicating why a certain drug was chosen or why a treatment might be difficult helps build trust and really empowers patients in their own care.
So this all leaves us with the ultimate question, doesn't it? The future of treating brain disease really rests on our ability to find this delicate balance. The hunt for that master key continues, one that can unlock the door for life-saving medicine, while keeping it sealed shut against all the dangers of the outside world. It is a challenge that sits right at the very heart of modern medicine.